Good afternoon and welcome to Your Health is Wealth. I'm your host, Dr. Stephen Katz, alongside my co-host, Dr. Loreena Ryder. We're here to help navigate your journey to wellness. We like to do it simply without all of that horrible, confusing medical terminology that everybody hates. We are here to provide practical solutions to your health issues that allows your body's healing systems to do the work for you. It's simple, it's natural, and it works. If you're still struggling with your health, you can come see us at Naturopathic Physicians Group to help get your life back.
So last week we began talking about diabetes type 2, and we will continue that discussion today. Mostly we are going to be talking about all of the naturopathic testing, naturopathic treatments, and things that you can do naturally to prevent and help manage type 2 diabetes. But first, let's just do a quick recap of the symptoms you might experience with diabetes type 2.
Most common symptoms people will say is sugar cravings, increased appetite. Again, diabetes is a blood sugar disorder. It's an inflammatory condition in which your body is not able to regulate that blood sugar. So other things that show up with that, increased urination. These are people that will feel like they have to pee all day long, and if they collect that urine on a urinalysis, it will show blood sugar in the urine, and it'll also increase thirst, so you'll always feel like you can't quench that thirst.
Some people experience blurry vision or floaters in vision. Now, if you have floaters, you don't automatically have type 2 diabetes, but it is associated, and blindness with long-term diabetes as well. You can also develop peripheral neuropathy. Sometimes this becomes permanent diabetic neuropathy. This is numbness and or tingling in the hands or feet. Also weakness and fatigue accompany diabetes type 2, and also a weakened immune system, and just the ability to fight off infections is just not as it used to be and just not optimal.
And those are symptoms that a lot of conditions can potentially have. So again, you've got to rule a lot of different things out. But that being said, it's not usually very difficult to diagnose somebody with diabetes based on just standard blood work. And again, we'll get into more detail of causation, because it's not just about getting that diagnosis of you have diabetes. It's how do you treat it appropriately, and how can you get rid of it without having to be on drugs the rest of your life.
Yeah, and you may have heard Alzheimer's referred to as type 3 diabetes. We talked about that a little bit last week. There is a high correlation between diabetes and Alzheimer's, because diabetes really does affect your long-term memory. Dementia, Alzheimer's, you might hear that type 3 diabetes.
Yeah, and the prolonged diabetes is the issue. If your blood sugar is high for long periods of time or uncontrolled, that's when you get the things people fear the most with diabetes. Most people that are pre-diabetic or early onset diabetes, where they're just taking like metformin or a single pill, they don't think too much about it. I hear that a lot in my office, where they're like, I'm told I was pre, but right now I'm okay. The truth is that's the time you need to be most aggressive with it, so it doesn't turn into an insulin dependent. But if it becomes uncontrolled or you become insulin dependent, now you're talking about the long-term ramifications of elevated blood sugar becoming a potential reality. That's when the retinopathy and the blindness happens, because the high blood sugar is so damaging to your eyesight. And that's when people start having those necrotic infections, where the infections in their leg won't heal. So now their skin is starting to turn black, and they get ulcers, and they end up having to get amputations. So that's the thing most people fear when they think diabetes, but that's a prolonged high blood sugar condition that could have been treated long before. And of course, it's also damaging to your kidneys. And again, you only get 2. Some don't even get 2. You can't live with 0. So
take care of your body.
Take care of those kidneys.
Some of the causes of diabetes type 2, the biggest one is going to be overweight and obesity and metabolic syndrome. So if you've been diagnosed with metabolic syndrome, you really need to pay attention, because diabetes is either very near in your future or already there. Metabolic syndrome is a cluster of risk factors that increase the development of heart disease, stroke, and diabetes. And they're basically just measurements. that diagnose metabolic syndrome. So your waist circumference, your triglyceride levels, your HDL cholesterol, your fasting blood sugar, and your blood pressure. If they are above a certain number on each one of those, you could be diagnosed with metabolic syndrome.
But in general, overconsumption of food, foods high in carbs, and of course the bad carbs are going to be the real killers out there. And again, refined sugars, artificial sweeteners, any of those inflammatory foods. So we'll talk a little bit more, but we talk about it almost every episode where we talk about these particular foods are always inflammatory to your system. It's not just about sugar with diabetes. The sugar is what's showing up in the blood work, but it's the inflammation your body is producing that damages the pancreas, and the pancreas then has an inability or inefficiency at producing the insulin in order to lower that blood sugar. So if you're eating a bunch of processed inflammatory foods, you're going to be a higher risk of developing diabetes. And of course, lifestyle, exercise. You've got to keep the blood pumping. You got to keep the body healthy.
Yeah, and those inflammatory foods, you should think about oils as well. There are healthy oils, which actually help your body and reduce some inflammation and provide really great fats. And then there are highly inflammatory oils. And most of the time, these oils are turned bad due to the processing in those. And they're typically referred to as seed oils or the hateful eight. You can easily Google those, but they're in fast foods, fried foods, and they even hide them sometimes in healthy packaged snacks like whole grain crackers and protein bars.
But ultimately, organic doesn't mean healthy. Low carb doesn't mean healthy. It's what are they putting in there in the process. So when you see organic cookies, organic crackers, organic chips, just because it has that term organic does not make it a health food. And when you walk down that health food aisle in the grocery store, it's garbage after garbage with a sprinkle in of some healthier food, but it's all labeled with organic. And sugar is sugar, whether it's organic or not.
Yeah, try to be smarter than the marketing crews whenever you're reading ingredients. Thanks for tuning in to Your Health is Wealth. We are the doctors from Naturopathic Physicians Group located in Scottsdale, Arizona.
Every week I do a segment called What Isn't Your Doctor Telling You? And I'm going to do it this week. So I want to talk a little bit about the diabetic index. So this is something that a lot of people use to try and determine whether or not they're eating a healthy food based on their diabetes. And I look at the diabetic index and I see a lot of flaws in that process, but yet there's a lot of diabetic specialists. There's a lot of doctors out there that tell their patients that they should be using this. Now, again, I'm not trying to give the medical advice here. I'm just saying sometimes you've got to use some common sense when you're thinking about what's healthy and what's not. Because according to the diabetic index, carrots can be worse for you than ice cream. So let that sink in when we're talking about common sense when it comes to being healthy. The reason why is when you look at the diabetic index is based on singular foods. If you're eating this food by itself, what happens with the blood sugar? So when you eat a carrot, because there's no fat in that carrot, your blood sugar will spike up really fast because of the carb base in the carrot. So they say that's bad if you have diabetes. So don't eat your carrots according to the index. But carrots are also really good in vitamin A, which protects your eyes. They're good for your kidneys. So all the side effects of the blood sugar, the carrot's really good for. On the other hand, ice cream contains a lot of fat with those carbs. So the spike isn't quite as horrible when you eat ice cream as it is when you eat a carrot. So naturally, they tell you that the diabetic index would tell you that eating ice cream is safer for a blood sugar spike than a carrot is. So again, I look at this from a common sense perspective and say, nobody got diabetes because they ate too many carrots. Plenty of people got diabetes from eating too much ice cream. So again, think about it from a common sense standpoint. And again, talk with your doctor and ask them, based on this index, should I really eat more ice cream over carrots? And if your doctor says eat more ice cream, you should find another doctor.
Yeah, Bugs Bunny was not necessarily the picture of diabetes.
Yeah, he was not. And he ate carrots every episode.
He did. All right, let's talk about some naturopathic testing. So if you go to a naturopathic doctor rather than a conventional doctor, we will do some of the same blood tests, but we will also do some of our own specialized testing. So the labs that we would do that would be the same as a traditional medical doctor would be the HbA1c, hemoglobin A1c. Some people shorten it just calling it A1c. This is the 2 or 3 month average blood glucose marker. Also a CMP with fasting glucose. That's a comprehensive metabolic panel that tells us about your liver and kidney function and includes the fasting glucose. Those are 2 pretty basic labs that we do, as well as an MD would do.
Yeah, and one of the big ones we say week in and week out is a food allergy, food sensitivity panel. I ran 2 of them just today because these are life-saving tests that your primary care physician has probably never even thought about running for his diabetic patients. Think about it. You're eating food. Food is creating inflammation in your body. Wouldn't you want to know what foods are triggering that? If diabetes is an inflammatory condition, wouldn't you want to know which foods are creating that inflammation? Because if you don't, it could be, that old phrase, one person's trash is another person's treasure, and vice versa. Some people will show up with avocado on their panel. And think about that. Avocado is supposed to be one of these major health foods, but if it shows up that you're allergic or sensitive to it, it's creating inflammation every time you eat it, and you're making your condition worse, thinking you're doing the right thing.
And 2 things on that. You may not have any symptoms that you correlate with that inflammation, number 1. And number 2, some people actually don't want to know.
Yeah, it's one of those tests that if you do it, you should follow it because it's telling you point blank what's wrong when it comes to when you're eating. But the other thing is a lot of people try to do the elimination diet with this, and it fails almost every time. Or they try to piecemeal it and they try to pay attention. And they're like, I'm just going to watch what I eat and see if I can figure this out on myself. It's like playing darts without a dartboard. You can't do it. And I use that analogy in the office all the time. It's playing darts without a dartboard. Because most inflammatory food reactions are known as delay reactions. So you're going to eat something and you could react 10, 12, 14 hours after eating it and still be something you ate 14 hours earlier. So how are you supposed to figure that out when you've had 2 meals since then? And what if in those meals you ate something crappy during that time as well? So it's just getting compounded over and over again, and you're just beating your system with more and more inflammation.
Yeah. Another test that we will run that I don't too often see on a conventional panel is the fasting insulin test, which kind of flabbergasts me because I don't understand how, if you're dealing with someone who has insulin sensitivity, why you would not calculate their insulin. But the fasting insulin number is also used to check a marker called HOMA-IR. It's the homeostatic model assessment of insulin resistance. I love this marker because this is an early peek into a window of if you are having early insulin resistance. So this might show up before your A1C shows any out of range numbers, before your glucose and your actual insulin show any out of range numbers. So that's something that I don't see often at a conventional office.
Yeah, and fasting insulin is a really cheap test. So patients should get this done, but it's also a great way to monitor how your diabetes or pre-diabetes is doing. If your body has to produce more insulin and insulin lowers that blood sugar and your blood sugar's creeping up, even if your body's making more insulin, it's telling you your insulin is not working well, which means you're becoming more insulin resistant, which means you're developing diabetes or worsening your diabetes. However, if your insulin level starts to go down and your blood sugar is going down as well, that means the insulin you don't need as much insulin to maintain normal blood sugar, which means you're less likely to be developing diabetes. And then, of course, you can see those correlations when you do your blood work. So it's a huge part of monitoring, treating, and helping you prevent diabetes.
Yeah, and insulin is one of those Goldilocks numbers where if it's too low, that's also not good because it's just not working effectively. If it's too high, then that's the tendency toward diabetes.
You love Goldilocks, don't
you?
I
do.
Yeah, it is a good analogy, commonly. But yes, you don't want too low. You don't want too high. Like anything in your body, it's about what's right. What is the optimal function? But the range they have on the labs for insulin are ridiculous.
They're pretty big.
The range is like, what, 2.5 or 3, all the way to 25.
Yeah.
That is terrible. 25 with a high blood sugar means you have way too much insulin and your blood sugar is still not under control. That's not good. You want to be in like a 3 to 10 range with normal blood sugar. And if that blood sugar keeps creeping up and your insulin levels creeping up with it, it ain't working.
And that's why it's important to have these done annually, even if nothing wrong is showing up, because that way we can see trends and we can catch things early and we can say, hey, it looks like this has been trending up over the years. We probably want to pay attention to this. Another test that we do at the naturopathic doctors is a fungal screen. So blood sugar feeds bad fungus like Candida and Aspergillus in our system. And this can cause many other conditions in the body. But if you have Candida, a lot of things aren't working, like hormones. People don't really think about that. I learned something over the weekend that Candida actually grows roots in our hormone receptors. And that's why some people, specifically women, tend to have sugar cravings and tend to have Candida infections chronically and can't quite get rid of it.
Yeah, those yeast infections, very common with diabetes patients. The other thing with that is our food panel that we run also measures Candida and the Aspergillus. And it does that because it's that which came first, the chicken or the egg. It doesn't even matter. It's because if you have that much inflammation in your body, you're going to weaken your immune system and you're going to be way more likely to develop a fungal issue. And when you're talking about the blood sugar cravings, when you kill off that fungal, when you're trying to kill the fungus in your system, they're going to send more signals to you to want that sugar more because they need to feed it. So that's where a lot of times people will get die-off and they'll get a lot of symptoms. Sometimes they feel worse before they feel better when they actually kill off the fungal.
Oh, yeah, those die-offs. That's fun. That's stinky gas, skin eruptions like acne.
It does depend on the crowd if that's fun or not. If it's people you don't like and you're in a closed car or something like that, the die-off could be fun.
Yeah. Don't mind me while I kill my Candida. We also check for pancreatic enzymes. This is helpful for digestion. So the insulin comes from the pancreas. If the pancreas is damaged, then your blood sugar and your digestion is going to be off. And we can see this. We can catch this on labs even a little bit early. But something else that is an indication for you pretty early is, are you having GI issues? Are you having gas and bloating after you eat? Those things aren't normal. And some people think they are because it's happened to them for decades. But it's an early indicator that something's awry.
And we said this last week in part 1 when we pretty much only talked about the conventional stuff. Diabetes does not have to be a difficult thing to treat. It's complex, but if you treat it before it becomes insulin-dependent diabetes, oftentimes you can get off those medications and you can heal and not just feel better, sustain that wellness, and that's what we love to do. We are the doctors from Naturopathic Physicians Group, and today we are talking about naturopathic treatment options for diabetes type 2.
Dr. Ryder here with your tip of the week. So let's talk about overnight glucose control. If you happen to wake up in the night, possibly even around the same time every night, this could be a glucose regulation issue. It could be other things as well, but today we're talking about diabetes, so that's what we're going to concentrate on. A high-protein, low-fat snack before bedtime can help people with diabetes regulate their blood sugar overnight. This is what I recommend to patients. Just have an herbal sleepy time tea at home. Heat up some water, put that tea bag in there, and then add some collagen peptides. They're tasteless. This can actually help out with that waking up every night if it is a glucose regulation issue. So collagen, depending on the brand, usually has anywhere between 11 and 18 grams of protein in it. No fat, no carbs. So this can give your body the protein that it needs without those fat storage promoting fats and carbs to regulate that blood glucose while you sleep. So this little trick can help you get that full night's rest without waking up in the middle of the night for no apparent reason.
That's a good tip.
Thanks.
Maybe I'll sleep better now. No, I sleep pretty good, actually.
Good.
My sleep number tells me.
Nice.
So let's get into naturopathic treatment options. One of the things we do in office for people that have blood sugar issues is IV therapies. If you've never done an IV therapy, we offer, I don't know, about 20 different IVs in the office. But when it comes to blood sugar, the biggest one we recommend to our patients is alpha-lipoic acid infusion or IV. ALA is a major antioxidant, and it's been shown to not only lower blood sugar, but it also helps the symptoms of people that have long-term issues according to that blood sugar. So when we talked about the kidney issues, ALA is protective to the kidneys. People that have neuropathy, we've used alpha-lipoic acid and actually healed damaged nerves. Yes, I said that. It can help heal damaged nerves. We're probably going to get cut off by the American Medical Association for saying that, but you know what? It is what it is. We do what we do in the office, and that's what we do. But basically, these are treatments that also can help protect your eyes, and they're just great for your immune system. But again, when we offer treatments to patients, these are individualized treatments to the patient. So this doesn't mean if you have diabetes, we're going to give you this infusion. We still check everything else and make sure it is the right treatment for you. But it is one of our things we have done in the office and just seen amazing results.
Yes, this is a really great IV therapy. And we give different doses based on the individual patient as well. It isn't cookie cutter one IV fits all. We make it individual for what that patient needs. I did have a wheelchair bound patient who now walks easily with a cane and a walker, and her foot doctor was astounded and never thought she would walk on that foot again. And these are the IVs that she's been getting.
Yeah, so what is one of the biggest things we talk about when it comes to blood sugar? We've already said it. The food is so vital. So the diet plays your biggest role when it comes to maintaining and treating and preventing diabetes. So when you talk about the insulin resistance diet, which has a lot of research on it, it's basically don't eat the sugary and the carby foods. Don't eat the grains, and the sugars are restricted. You want to make sure you're maintaining those vegetables. And of course, you're still going to limit the fruit with this diet because the fruit breaks in. The fruit is all the sugar too. But again, like I said earlier, nobody got diabetes because they ate too many blueberries.
Yep.
They got diabetes because they ate too much blueberry pie. Again, it's still using it, but the insulin resistant diet does limit fruit. But again,
yeah. And a side note on that fruit, if you're going to eat fruit, eat the whole fruit. Fruit juice is not equivalent to fruit. So whenever you have orange juice, it juices the orange out and leaves the flesh behind. So that flesh of the fruit is actually like a slow release for sugar. And it also has fiber in it, which helps the slow release part. So you're getting, with orange juice, you're getting a big hit of sugar, and then that spikes your glucose, and then there goes your insulin. So just eat the fruit. Eating an orange is so much better.
And on that note, too, think about fruit and think about fruit juice with what you're saying. Why is it every time you drink a glass of Tropicana or Simply Orange, does it taste the same year-round? It's an important question to ask because anybody who's ever eaten an orange before knows no orange really tastes the same. This orange is going to be a little bit more sweet. This one's going to be a little more bitter. It's going to always have a cycle of when was it picked and how fresh it was when it was picked. But yet every single time you drink those packaged orange juices, they all taste the same year round because they're flavored.
I never even thought about that.
Yeah, it's one of those things like, how can they make it taste the same every time? Because it's not just orange juice.
And pulp doesn't count as the whole orange.
Yeah, pulp does not count as you now eating the orange. Eat the damn orange.
Yeah. Also, intermittent fasting, when speaking of diets. Now, you were talking about the insulin resistance diet. Intermittent fasting allows a full digestive cycle clearance. So this does help decrease inflammation, does help with digestion, and it protects from insulin spikes. There are different variations with intermittent fasting, and some people, if you are adrenally deficient and you know this, intermittent fasting might not be a good idea for you, but most people can handle certain levels of this. So you can just easily skip breakfast. This is pretty popular with most people if they're doing intermittent fasting, just skipping breakfast. You can skip any meal. It can be lunch or dinner. You can consume your food between the hours of 12 to 8 or 11 to 7, whatever fits into your lifestyle. This doesn't have to even be done every day. You can do this once or twice a week, and it still helps your insulin. This can be done every third day of the week, whatever you decide out and works best for you.
Okay, and with this diet as well, if you are insulin dependent, diabetic, this would not be the right diet for you either. And again, we're never telling you to start or stop anything. We're just giving information. When you get to the point of when you're insulin dependent, you can cause yourself to crash in your blood sugar as well. And you have to be careful. It's why you monitor it when you do that. But not every diet is going to be right for diabetes. It depends on what stage of the diabetes you're actually in. And we already talked about running that food sensitivity test. That's your game plan when it comes to knowing exactly what foods are inflammatory, because then you can pick which foods are healthy and which foods are not.
Fiber-rich foods are really awesome. They help decrease your blood sugar and optimize how well your bodies use insulin. And there's a lot of different fiber-rich foods out there. Avocado, prunes, whatever fruit is a good one. But whatever you can find that's fiber-rich is really going to help stabilize that blood sugar.
And in Arizona, you can go find things called nopals, which are made from prickly pear pads, or are prickly pear pads. Cooking these pads has shown to lower hemoglobin A1C. Now, as a person who's touched prickly pear cactus before, don't go pick it yourself. Go let someone who knows how to do it. And then that's when you'll eat, cook it right and then eat it, because I did try to pull out the prickly pear once, and my hand hurt for like 3 days. They got all those little stickers in there, and they're like impossible to get out. But I've also fell in a cactus before. My sister would say I was riding my bicycle while playing football, which is not a physically possible thing to do, but that's the story she tells me I did when I fell in a cactus and had to rip out like 200 stickers in me, and that was not a fun night. It was the worst.
I'm sure. There's also supplements that you can take that help with treating or preventing diabetes. Now, we talked about alpha-lipoic acid earlier in an IV, but you can also take ALA in a supplement that helps lower blood sugar. It curbs your appetite. It can help protect from neuropathy, helps with nerve function to the eyes, can help retinopathy. It also helps kidney function. And all of these conditions that are affected by long-term diabetes complications can be helped with alpha-lipoic acid supplement. However, you can't get as much of a dosage in there as you can in an IV, just as a side note.
So we're jumping right into treatments because we want to make sure we get through all of these today. We were talking about supplements in the last segment, and one of the ones we love to use is inositol. Now, again, I say this every week. We are not telling you to go out and buy a bunch of supplements. We're not telling you to go out and do anything. We're telling you to discuss these with your practitioners if it's something you're interested in. And if you're not sure which ones are the right ones, you can come visit us at Naturopathic Physicians Group, and we can make sure you get tested correctly, and we can make sure you're on the best treatment to sustain your wellness and regain your health. But inositol helps regulate blood sugar, but it's also great because it also regulates other hormones. This is found in a lot of products that are both beneficial to help maintain that blood sugar, but we also see them in a lot of our supplements we use to regulate adrenal hormones and sex hormones.
Chromium is a supplement that helps reduce insulin resistance. It lowers blood sugar levels, and you can also avoid kidney disease down the road, hopefully, with the use of chromium, just because of its benefits, its anti-diabetic benefits. Sometimes you can find this in like a proprietary blend of a diabetic supplement, or it can come by itself.
Yeah, a lot of the products, we do more about single ingredients, but a lot of the products that we use will have multiple components to it because some are good at the insulin part, some are good at actually lowering the blood sugar part, and some are more preventative. Quercetin, we use quercetin for a lot of different things, including blood sugar. It's also really good for fighting allergies It's a natural antihistamine and a natural mucus thinner, so it's going to help with multiple levels regarding inflammation in your system.
Resveratrol, this is a good one. This helps improve hyperglycemia, which is high blood glucose, even glucose dysfunction, whether it's high or low, and high lipids. And resveratrol is one of those longevity supplements, so it has a lot of benefits to it, but helping prevent diabetes is one of them.
One supplement that has been studied for many different things is berberine. It's most famous as a anti-blood sugar. It's most famous for its diabetic properties, but it benefits a few other things in the system as well. It's a great anti-inflammatory, but studies have shown time and time again it decreases your hemoglobin A1C. But this is one that will interact with other diabetic meds. So you do have to, again, discuss with your practitioner anything. And also this one can affect pregnancy, so you don't want to be jumping on this one if you've been jumped on.
Zinc is, oh my goodness, I got to catch my thought here now. Zinc is
I got to
really
throw something in once in a while to make sure you're paying attention.
Zinc is good to add in if you have diabetes type 2 or if you're just trying to prevent it. There's a lot of reasons to add zinc into your regimen, but diabetes type 2 patients have been found to be low in zinc. So when you have that correlation, it's just good to throw it in there.
And a lot of studies when it comes to diabetes has been more herbal treatments than necessarily nutrients or vitamins. And there's a lot of herbs out there that have been used for 1,000, 2,000 years that have been studied and shown to be beneficial for protecting blood sugar issues. One of those that you would never think about is cinnamon. It's found in all those sugary cereals, so you're like, it's got to be like sugar, but truthfully, it's almost the opposite. Cinnamon and sugar, like Cinnamon Toast Crunch, the cinnamon good, the sugar bad. But the cinnamon probably balances out that sugar from or at least tries. I think they put a lot more sugar than they do cinnamon. But cinnamon has shown to improve glucose in the system as well as can help lower your cholesterol. So this is one of those ones you can sprinkle on a lot of food. Now, on the other hand, unlike a lot of things, there's that thing out there called the cinnamon challenge that you should not do unless you want to die. So, yeah, you remember that?
Yes.
Yeah, basically people would take a spoonful of cinnamon and eat it, and it was causing them to choke because it dries out their mouth so instantaneously, and they get that powder into their lungs and it causes them to aspirate. So kids were doing this, they were dying. Teenagers were doing this, college students were doing this, and they were dying. Don't do this. It's stupid. That being said, putting cinnamon on your food can be good.
Or in your drink, in your coffee, in your tea, whatever you have, throw cinnamon in there.
But on the other hand, if you're buying one of those 800, 900 calorie lattes, you put a little cinnamon on there, it's probably not going to do that much.
There's also an herb called mamortica or bitter melon. This inhibits the absorption of glucose from the intestine, therefore decreasing your blood sugar. So this helps improve lipids as well and is great for glucose metabolism.
Panics ginseng. I love ginseng because a lot of my patients also have fatigue, and ginseng is a natural stimulant, so it helps the body with energy. But the studies have also shown that it helps with sensitivity, increased sensitivity to insulin, and it also can decrease your blood sugar. So Panics ginseng is found in a lot of the blood sugar supplements out there.
Gymneba is an Ayurvedic Indian herb. It increases the secretion of insulin, which helps decrease elevated blood sugar. And this also is really great for helping control sugar cravings. It helps curb your appetite and helps with weight loss.
Yeah, Gymnema is definitely one of those go-tos we use for people that have those cravings. It has a chemical component to it that blocks the sugar craving side of it. So it does make it easier for people to diet correctly when they have diabetes. And stinging nettle is an herb that reduces glucose production in the liver and improves that blood sugar control. Now, stinging nettle, I have a great story. When I was at the school, when I was a student, it was Southwest College of Naturopathic Medicine. Now it's called Sonoran University. When I was in med school, I was giving a tour in the back of the school because I used to do a lot for the school when they talked to me regularly. Now Here and there they talk to me. They still like me, I think. But when I was giving a tour in the back, we used to have stevia leaves in the back. And stevia leaf and stinging nettle leaf look very similar to each other. They were doing some campus reconstruction in the back, and when I was giving a tour, I used to let people chew on a stevia leaf so they could taste what stevia tastes like as a leaf, since it's such a sweet alternative to sugar and natural. I didn't know about the construction, and they moved some of the plants around, and I went during a tour and grabbed a leaf of stinging nettle and not stevia. Now, it's called stinging nettle for a reason, and my whole hand got a lightning bolt strike into it. And I had a test an hour later, and I could not feel my whole right hand because it was like lightning pulsating pain strikes. And then I did it right on the tour, so I looked like an incompetent moron when I was giving them the tour. But I told them, here's what you learn from this. Don't touch stinging nettle.
I'm just glad it didn't make it into anybody's mouth.
I don't think I would have been able to hand it to them.
Also, milk thistle is fantastic. It helps decrease blood glucose levels. It provides support for the liver. It's fantastic for the liver. And that's where sugar gets processed, right? The liver has a lot of big jobs, and milk thistle just helps support that.
Fenugreek is one of my favorites, not because of, I don't use it a ton for blood sugar, but it has been used. It's been used for hundreds of years. It lowers bad cholesterol. It helps with A1C. But I love this one because it makes your urine smell like maple syrup. I just thought that was funny because it's like you want to make some pancakes, and if you use some fenugreek, you can make your urine smell just like those pancakes. So it is harmless when your urine smells like maple syrup. That being said, it's a fun fact.
Aloe vera can help improve insulin function, lower blood sugar and A1C. It can also help protect kidney damage and eye damage due to blood sugar. Just don't overdo it with the aloe or you will have some runny stools.
And ginger, great for digestion, great anti-inflammatory. In conjunction with other things, can help lower blood sugar. Awesome herb. And reduce your anxiety. I know it's easier said than done, but anxiety stress induces cortisol, which inflames your whole system, and that inflammation can help be a contributing factor to damaging your pancreas, which then increases or decreases your natural insulin production, and you can get diabetes.
Hug more, hug longer, hug often. It releases oxytocin, which helps the pancreas regulate insulin.
So thank you for tuning into Your Health is Wealth. We are the doctors from Naturopathic Physicians Group. We hope you enjoyed our two-part segment on diabetes type 2, and we will see you next week with another episode.